And this is exactly the instrument that we need here now, alligator forceps. This patient, let's call her Ilaria Sand. Here we're looking at Ilaria's right ear. I begin with a standard size Zollner, and here the tip touched the surface of the oiled keratin, and immediately on the left side of the screen, otherwise known as the rostral region or towards the nose, you can see how hard the skin is because it's actually caused a little sore or cut in this area. And sometimes this can happen, particularly with very thin or inflamed skin. It may have actually already been there too, but we will never know. So I'm back in, and this time I'm trying the suction on the other side of the actual keratin so we don't disturb the sore looking area. And the whole section of wax moves almost like a cast over the top of the skin inside the ear canal, but it's actually stuck a little deeper down. I'm going as gentle as I possibly can, and the sheet of keratin is kind of just turning on itself here. Here I'm using a rosin inserter. I was hoping to actually hook behind the wax and drag forward, but I decided not to do that. Look how hard and moulded that looks. Back in with the Zollner, and what's really evident here is that the suction is poor, which is down purely to the hardness of the skin layer you're seeing here. It moves everything forward, but still stuck in the background somewhere. Some of the keratin has peeled off from that raw skin, and in the deeper aspects you can see more redness being revealed. And this is exactly the instrument that we need here now, alligator forceps. These gently pinch the end of the keratin. A piece comes off, but I didn't want to continue using it as I didn't want to rip the skin off. And it was the right thing to do because the remainder of it came away nicely with a Zollner just here. In again to see what's going on, and there are some leftover pieces of keratin at the top of the canal. I've even tried to use a fine tip Zollner here to see if it suctions some of the lateral parts off, but it doesn't. So I have pushed the keratin back up to the roof of the canal to get it out of the way, and I will simply leave it there. I have seen a piece of wax just in the corner here, so I'm using a fine tip Zollner, and that comes away with relative ease. There's also a straggler here very close to the top part, which has the sore area under it, so I'm gently removing the keratin here with the suction. And here we have the final shot of the eardrum, some oil around the periphery and a slightly milky looking eardrum, but all is good here. In comparison, here is the other side, the left side. You can see that there's lots of skin on the roof of the ear canal as we go in with the camera. You can see just how thick and milky it looks, and there is obviously a huge hole in the eardrum, but everything is dry, which is exactly what we want. So everything is good here, and Ilaria can go back to using her hearing aids again. And that's it for today, folks. Thank you so much for watching. I appreciate you as always. Please keep sharing, subscribing, and I will see you in the next one. And for those who are still listening, free Palestine.